Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Cokerhook. Tonight we're going to be engaging in the second episode conversation with Sally Adelus here from Hospice of the Valley. The last time we talked more about the hospice network in general, what hospice is, why people should be thinking about it, what some of the myths are that we hopefully dispelled in our conversation last time. And this evening, Sally, I want to talk more about Hospice of the Valley. I understand from something you mentioned earlier that Hospice of the Valley was the first or second organization of its type in California, which is fantastic.
The second organization of hospice in California.
Second organization.
We're really proud of that.
I should think. So, and when was that? When did it start?
Well, 1979.
Oh, wow.
Yeah, way back yonder.
Yeah,
yeah.
a few years ago.
Although when I say that we started at that point in time, there was a group of individuals in this valley who were the real icons of Hospice of the Valley. And I won't say all of their names, but they know who they are out there. And if it wasn't for them getting together, and one in particular, Jenny Maggot, all those years ago, who had seen the hospice movement occurring over in Europe and said, Santa Clara County needs that type of care here for those that are towards the end of their life. Her husband himself was in hospital, dying of cancer, and she had a young family, and she said hospice, it was so needed. There was not this type of care available in Santa Clara County. And she got a group of other like-minded visionaries right here in this valley, and they sat around the table, and what was called Project Journey was born.
Oh,
and
wow.
they were on a journey to create hospice.
Wow.
Here in Santa Clara County.
That's fantastic. And now, so many years later, I'm not going to try to do the math in my head here, but some number of years later, we have the network that you guys have developed here in the Santa Clara Valley. So let's talk a little bit more about what Hospice of the Valley has to offer the community.
Well, last time we had this conversation, we talked about what we have as our core hospice program, which is the program for individuals who are facing towards the end of their life, in the last 6 months of life, that have decided that they do not want to continue on the course of curative treatment.
Right.
And the focus, if you will, of care changes. It focuses on comfort, quality of life, and relief of suffering.
Right.
No, not prolongation of life. So if you will, that is our core hospice program.
Okay. But
Hospice of the Valley has evolved through the years. We've grown up a little bit, if you will, since back in 1979. And we have a wonderful community grief and counseling center, which is open to the community at large. We are mandated under the regulations of Medicare hospice benefit regulations, as well as most private insurances, to provide 13 months of bereavement support to our hospice families that we serve after the loss of their loved one.
13 months of bereavement support after the person passes. So the spouse or the children,
immediate
or
caregivers,
whatever.
Family members. Yes.
Wow.
So
what 13?
What does that mean?
Yeah.
What does that mean? Well, every hospice will offer perhaps a slightly different interpretation of what does that mean.
Yeah.
At Hospice of the Valley, we have a very comprehensive grief program. That means that we serve children, very unique in the fact that we serve children that have experienced a loss. It may be that they lost their father, their mother, their sibling, their grandparent. And so we have a very, very comprehensive grief support program for children. Littles, middles, tweens, and teenagers. One of very few in Northern California that offers that type of specialized grief support for children. In addition to that, we offer grief support for adults, whether it be one-on-one counseling, or it can be within a group setting. And I talk about age-specific and loss-specific. If you were grieving, can I bring an example?
Please
For your recent loss of your dear mom? if you were going to go, Dave, into a grief support group, you may want to be in a group with other individuals that have experienced the loss of their parent.
Mm-hmm.
So we have a parent loss support group.
Mm-hmm.
We have a child loss support group. So it's age specific and loss specific.
Mm.
And I think that's very unique in the fact that you may not want to be in a support group with individuals that do not have a similar type of loss. You can identify
that makes
more.
a lot of sense, because just because something has occurred, I mean, the experience of the loss is going to be different. Thank God I've never had to experience the loss of a child, but I can just sort of intellectually understand how different that would be than the loss of a parent.
Yes.
Which I have experienced, because both of my parents are gone. But it's and so I can see how you would, if you were going to engage in some kind of supportive activity, that you would want to be able to talk with people who have a similar thing. One of the things that's, I think I mentioned this to you in a conversation we had earlier, there are lots of groups that come together for similar type things. Mothers with multiples, or families that are just starting out, with the wife is pregnant and the husband and wife get together with other, pregnant people. And so that sort of thing is common. The question is, how common is it within the realm of someone who's experienced a loss?
It can be a little daunting at first, actually. I mean, I don't know about you with grieving the loss of your mum. It's something that perhaps, I don't need a support group. I know when I lost both of my parents, here I was as a CEO of Hospice of the Valley thinking, I know all about this. I don't need to. But I did. And I think it's just being open to the fact that sometimes it's sort of that human connection. And it can be a very powerful human connection to get support from other individuals that are going through a similar type of experience, but creating a nurturing, safe haven, if you will, to allow you to start to process your grief. If you're not sleeping, or you're thinking that you wake up in the middle of the night and you can feel the presence of your loved one, those experiences, to be in a group and have a professionally licensed counselor say to you, that's a normal experience, and validate that experience. Is very critical, because sometimes we can go through our grief process and that we never get privy to being in having that support, and lo and behold, it's much later in life when we go through another grief experience then our house comes tumbling down, because we haven't worked through it. It
kind of re-stimulates the
loss, the trigger. So we're finding this a lot, and the other thing that we do offer for our families is workshops. I mean, we're getting close to the holiday season right now. One is called Getting Through the Holidays.
Sure.
The first time that you're experiencing, I know the first Thanksgiving without my parents was a difficult time.
Sure.
To be able to be with somebody that can tell me, what are the ways that could help me get through that holiday? What strategies could I use?
I mean, sometimes getting through the holidays is difficult enough in and of itself, because it has its own emotional challenges and stressors. But to do that in the context of having lost someone special in your life, I can see can be a very profound thing.
So workshops, those things that you don't have to, perhaps you don't want to come to a support group initially, or perhaps it's just an individual session that may be right for you. It's really about individualizing it. Perhaps it's a workshop, perhaps it's receiving newsletters. As a hospice, we provide a lot of different touches, if you will, opportunities. I can remember, I don't want to just talk about my experience, but when I got some information, is putting it away somewhere, because I might not want to do it just yet, but it may be 3 months or 6 months down the road, go, I think I need some help now. So the other part of Hospice of the Valley's programs around the Community Grief and Counselling Centre is that I mentioned that's to our hospice families. The Community Grief and Counselling Centre is open to the community, and that's a really different, unique part of the program services that we offer to the broader community, meaning that if you've experienced a loss, whether it's from a traumatic loss, a suicide or car accident, you can gain access to our community grief center to get support.
I think, Sally, you had mentioned to me before that within the context of that community program, school environment, something happens to a classmate that dies from whatever.
We've been called into schools to do crisis counseling for both, the teachers as well as the students.
And how many people
corporations,
do you have?
for example.
How many people do you have on your team?
We have a wonderful cadre of professionally licensed team members. We have a child life specialist that heads up the grief counseling for children. We have interns that are supported by a wonderfully supportive supervisor for our intern program. So we have interns that come in from the local universities that work with us in the Community Grief and Counseling Center. We have a whole cadre of support for that program. Plus, we have volunteer support as well.
So there's a lot of folks
many
that are involved.
of the volunteers that come to specifically want to volunteer into the Community Grief and Counseling Center are often individuals that have lost a close loved one in their life some time ago, and say, how could I give back? You helped me so much, how can I give back to the community?
Right.
And they come into the training program, and it's a real unique program with a wonderful supportive network of team members.
Very cool.
Yeah.
Where exactly are you guys located?
San Jose. If you look at the interchange of 85 and 17, very close to Good Samaritan Hospital.
Oh, okay, great.
Yeah. But independent.
Good.
Freestanding. Non-profit.
All right, so we talked about the general traditional hospice care, and we've talked about the grief counseling and grief support process. Are there any other programs that you guys have over there?
I would say three other unique programs. We have a program, well, what we found a number of years ago, close to over 5 years ago, that there was a lot of requests from the community where community members said, Mum's not ready for hospice. She still continues to go on chemotherapy or radiation therapy. The doctor says that hospice is not appropriate right now. She's still in curative treatment, but we just need some support. I live in Fresno, Mum's in San Jose, or whatever city it is in Santa Clara County. How do we go? We'd often say, well, she doesn't meet the criteria for coming on to hospice, and we would say, go to this organization in the community or go to that to try and get this support. Well, we started a new program, or it was new back then, called Transitions, and it's particularly tailored for individuals who have advanced illness in the last year of life that are still undergoing curative treatments. Now, some of those same individuals or clients may also not be emotionally ready for hospice. Sometimes you can make a decision. I think we've talked about this before, about choice at the end of life.
Right.
It's knowing your options that are out there. And for some individuals, they may say, hospice is not a program that I ever will entertain at any point in time. Transitions offers them this space of supportive, practical assistance, emotional support, having the difficult conversations maybe with your family or your medical
Give me some specific examples of what that means in terms of the transitions program? I'm kind of understanding, but I'm not sure I'm really grasping what
Practicalities. It may be that there is not a lot of family support around this particular individual in the transitions program. They may be undergoing chemotherapy and they just can't keep getting to the doctor's office. We can offer help with transport to the physician's office or where they're going for treatment. Maybe, doctor, talk to me about making an advanced healthcare directive. Tell me more about what do I need to do. I've noticed that Mum's not really eating as much. There's something called Meals on Wheels. So it's a sort of a program that helps connect with the myriad of resources in the community. It's sort of like a conduit, if you will, to helps you connect to all these different resources that perhaps you didn't know about.
That's very cool, because I can see that there are just untold numbers of people that...
How do you access them? So it facilitates that access. And also, another unique part of that program is a volunteer part. We have transitions volunteers. So all of those, they offer those myriad of different types of services: emotional support, companionship, practical help, education, talking, having those conversations. But very importantly, supporting that client where they are at that point in time. This is not a hospice program, most definitely not a hospice program. And it's open to the community free of charge as well. So one of the things that's really integral about Hospice of the Valley, the Community Grief and Counselling Centre I mentioned to you, as well as the Transitions program, we are very much dependent on the generosity of our community to support those programs so that we can continue to offer it free of charge to individuals and families that need them.
Great. Well, hopefully some of our viewers will respond to that knowledge. So, so Transitions, the Grief Center, the regular hospice offering that people would expect based on what knowledge they may have of hospice, and you implied that there were a couple others.
Yeah. Two others, I would say. Way back yonder again, back in the late 1970s, Hospice of the Valley was an all-volunteer organization. That's how we started, grassroots organization. When, again, we were mandated by the regulations under Medicare as a hospice, we had to start having employees. That was part of our regulations. However, from all those years, way back, we've still kept a very vibrant part of our organization of volunteers. We have a very robust, beautiful volunteer program. We have close to 160 volunteers that support every aspect of the organization, from Transitions to our Community Grief Center to our hospice program, to ambassador volunteers that go out and talk to individuals in the community, medical professionals, to office volunteers. Every aspect that you could think about that we could have volunteer support, they help us in every facet of the organization.
Wow. So it's just individuals who are lending their time and talent to support
skills,
the services that you
life
offer.
Skills.
That's awesome.
Yeah, and I have noticed one thing I'd like to share with you. Over the years, our volunteer pool has changed. We're seeing individuals from every aspect of diverse in our diverse community. All different skills, young, more senior or seasoned. Every aspect you will see a different volunteer, and we do wonderful trainings.
You just said that it's changed and it's become more diverse. What that implies that it had been for at least a period of time something.
Well, I think there was, many years ago, it was the sort of when you get to retirement. It was that age of when you get to retirement that you're going to volunteer. Santa Clara County has changed. The representation of the diverse communities. I mean, if you look at the diversity of the Latino population, the Asian population, so from every aspect, from every age group, we have students that might be going through medical school, or it's a really diverse.
I'm gonna guess or suggest that part of the reason for that is the growing understanding of what hospice is over these years since 1979.
I also think that's a very good point. It most definitely is this increased awareness, but there's more community engagement now. People are actually wanting to get involved in their community. They're sort of saying, this is something not only about giving back, but this is something that I really want to do. So we're blessed by that for our patients and our families and the clients that we serve, because we have this wonderfully diverse array group of volunteers. For our board of directors, they're all volunteers. Our board committees, our service league, which is a fundraising arm of Hospice of the Valley. Every aspect of Hospice of the Valley is blessed by volunteers.
Fantastic.
You asked me one other. There's one other.
There's one other. I was going to go there.
Part of our mission is about raising awareness, about education, about advocacy and choice at the end of life. And we take that really seriously. So we do a lot of education in the Valley in a numerous ways. We partner with Santa Clara University and put on an absolutely wonderful conference called Compassion in Action with Dr. Dale Larson, who's
I read something about that in one of your articles.
And that is targeted to the medical community about increasing awareness on palliative and hospice care and grief care. And then we do a lot of different workshops and partner again. These alliances are really important where you don't want to duplicate efforts, but sometimes by partnering with other organizations in the community, you can better serve the community.
Sure.
So a lot of education awareness, whether it be workshops, attending conferences, speaking at conferences, to not only raise consumer awareness, the general public's awareness about the choice of hospice, but also medical professionals' awareness about hospice. Because the research shows that medical professionals have very similar beliefs and misconceptions about hospice as the lay public.
Sure,
yeah.
I would expect.
Yeah.
How did you become affiliated, Sally? What was it that got you to be part of Hospice of the Valley?
I think it was way back in the UK originally. I started to have an affinity for this type of work. I worked in mostly with cancer patients, and I sort of witnessed the suffering there that I thought, we can do a better job. Even in the days when the hospice was this movement that was happening in the late 70s, early 80s, I was witnessing it, I was part of that, and I thought, we used to literally, in those years gone by, patients that were towards the end of life were almost sort of put down the lower end of the ward, and sort of nobody wanted to go into that room or go to that side of the ward. It was sort of a no-go zone, and it just seemed
wrong,
disparate, and not right. And so when I came to the US, I got involved in a number of pain clinics, and again, that was another new movement that was happening especially in California, in this particular area in Santa Clara County, and was very engaged in watching this development of this new specialty, pain management, come about. And again, started to witness inequities in pain care, that it wasn't available for everybody. Seemed a natural transference to when the position came at Hospice of the Valley. I'd always been involved in hospice. It was part of my heart's journey that I again moved back into hospice. I was also part in the UK, worked with inpatient units in the hospice.
And how long have you been with
setting.
Hospice of the Valley?
Close to 7 years now.
7 years, oh, fantastic.
Now, one of the things I'd like to share is that we don't have a freestanding inpatient hospice facility in Santa Clara County.
What does that mean?
That means, say, can I talk about your mom?
Yeah.
Perhaps if she was living here and there was no place for her to be cared for at home, she didn't have, or she couldn't go into, she had some pain crisis or symptom crisis, the only option that she would have at this point in time is perhaps go into a nursing home or a hospital setting. Although they're fine places, gets fine care in those types of settings, it's not hospice culture, hospice.
Right.
We visit patients in the hospital and in the nursing home, but to have a pure inpatient facility.
Is that an option? I mean, it's not an option here in Santa Clara
It's
Valley.
not an option. There is one hospice. There is one hospice in the VA
hospice. That is something
hospice.
that works. I mean, that is an okay thing. Hospices could have established of an inpatient facility.
Inpatient facility, yeah.
Okay.
And you do have it in many places across the states now.
Okay, great.
Yeah.
And are they able to come and be there during that last transitional part of life?
Or for a pain crisis or a symptom crisis.
Situation?
Acute situation, yeah.
Oh,
yeah.
Very cool. So is that one of your goals?
My personal goal, yeah.
Very cool. All right. Well, this is great. I think the thing that is special about it is how far you've reached into the community, and that reach continues. There are other hospice organizations here in the greater San Francisco Bay Area, I suspect.
Yes.
I mean, you guys serve
Yes.
Santa Clara County.
Yes, Santa Clara County.
San Mateo County,
Yes.
San Francisco,
Yes.
and
Yes.
Alameda, wherever.
Yes.
So, and do you network with the
We
other
do.
hospices here?
Most definitely. All hospice across this nation right now is faced with reimbursement cuts under Medicare. So it's very important that we do have those conversations with each other, because we want to increase awareness in the greater community about, we want to, for this beautiful program to continue.
Mm-hmm.
It needs to continue. So we have to come together in a unified voice, because to increase that awareness out there that we are faced with reimbursement cuts under Medicare. And the private insurances will likely follow. They tend to follow what Medicare does.
Sure.
So most definitely.
What percentage of the population do you think really knows about hospice at this point?
You know, that's a really good question. I think they said that less than 20%, even though I think it was 50% of patients that access hospice or could qualify for hospice, less than 20% actually utilize it. That's a few years old, that statistic. But it's getting better, but we've still got a long way to go. Yeah.
We have about 2 minutes left in the show. So I wanted to ask you if there were any other specific things you wanted to communicate about Hospice of the Valley.
It's part of the community. I would say it's part of the fabric of our community here in Santa Clara County. If there are individuals out there that think about volunteering, whether it be in fundraising capacity, we are a non-profit. We're very dependent on the, as I say, on the community. I would also say that we are in the business of increasing awareness about the options at end of life. And that's one of the things that I would like to take to the community as well. If you are unsure or you're thinking about hospice, start that conversation earlier.
Pick up the phone
Pick
and
up
call
the phone,
somebody at the organization.
Call us at Hospice of the Valley.
You know, I can, from my own personal experience, I can see the incredible value of that. I think most people are going to, we talked about this in the first episode, not want to deal with or confront the reality there.
No.
But it's the type of conversation that if you have it early, it's going to enable you to pass through this process somewhat easier.
And I think, you know, what hospice does so beautifully is it affirms life. We tend to associate it right with the very close of life. There's this whole realm where we can support patients and families and affirm living.
It makes that process, that end process, so much easier and much more of a, I'm not going to say joyful, but a positive thing. Makes it a positive thing. Sally, thank you so much for joining me here on Reference Point. I hope the folks in the audience, the viewing audience, have learned something about this and will come and support your efforts. Remember, folks, if you have any questions about hospice or you want to communicate any direct activity, you can send it through me via the email at, your
email,
my email, whatever it was, all of a sudden it just kind of went out of my head, but it's info@referencepointtv.com. And with that, I think we need to close off. So Sally, thank you so much for being here. And you guys are doing fabulous work, and I really appreciate your willingness to come on the show.
Being here. Thank you. Good questions.
Oh, good.